How did public health evolve in European history? Imagine living in a time when cities were crowded, sanitation was poor, and diseases spread easily. That was Europe many centuries ago. Over time, efforts to keep populations healthy grew from simple local actions into organized systems. This story of progress is tied to advances in science, new ideas about health, and social changes that shaped how countries protected their people. In the late Middle Ages and Renaissance, around the 14th to the 17th centuries, public health was mostly a matter of individual responsibility. Cities grew fast, and problems like dirty streets, overcrowding, and infectious diseases became common. People relied on monasteries and religious groups to run hospitals, but these efforts were limited. During this time, scientists like Fracastorus and Paracelsus made discoveries about anatomy and how diseases spread. They challenged old ideas like miasma theory, which blamed bad air for sickness. Medical schools began working more closely with hospitals, encouraging doctors to observe and describe diseases more carefully. As Europe moved into the 18th and 19th centuries, cities expanded even more because of the Industrial Revolution. This led to more crowded living conditions and worse sanitation. People started pushing for reforms, like better housing, clean water, and waste removal. Leaders such as Sir John Pringle and James Lind wrote about hygiene and disease prevention, raising public awareness. Private groups and volunteers helped build hospitals and teach about health. When scientists proved that germs caused diseases in the mid-1800s, it changed everything. The germ theory replaced the old idea that bad air caused sickness. This scientific breakthrough helped develop new ways to fight infections. By the late 19th and early 20th centuries, governments took a bigger role in public health. They set up health inspectorates to check sanitation standards and created labs to study diseases like cholera, tuberculosis, and diphtheria. Vaccination programs grew, especially after Edward Jenner developed the smallpox vaccine in 1796. Later, vaccines for polio and other illnesses became common. Despite economic ups and downs, public health agencies expanded, showing that governments understood their duty to protect the health of their populations. The 20th century saw even more progress. Antibiotics like penicillin were discovered and used widely, saving millions of lives. Mass vaccination campaigns helped control diseases like polio and measles. International organizations, such as the World Health Organization, worked across borders to improve health worldwide. Tools like the International Classification of Diseases help track health trends and plan responses. In the end, public health in Europe grew from small local efforts to complex systems involving science, government, and social reforms. Scientific discoveries in microbiology and medicine, along with social movements advocating better sanitation, played key roles. Over centuries, these changes laid the foundation for the modern public health practices that protect us all today.